The Heritage Foundation calculated the true cost of the House healthcare bill to be $1.5 trillion. How does spending that money bend the long-term cost curve of America's healthcare costs?
It doesn't, and I think you're referring to the Lewin study that Heritage Foundation commissioned. What this bill does is it actually makes healthcare costs go up, not down. What this bill also does is it expands the federal commitment to healthcare pricing. The CMS actuary, Medicare, said that this adds 2 percentage points to the government's share or to the healthcare sector in the economy. So we go from 16% of GDP to about 18% of GDP with passage of this bill. The point is basically this. This thing's a fiscal train wreck. It is the height of fiscal irresponsibility. We're creating a $1 to $2 trillion new entitlement program. What we know from experience is traditionally we underestimate the cost and size of these programs. For instance, Medicare was underestimated by a factor of 9. And what Congress traditionally does is underestimate the kinds of revenues they're going to get from the tax increases on small businesses, on employers, on individuals, and all the Medicare cuts that are in this bill to pay for this new entitlement. Those never materialize as they're planned as well. So what we do know is we're creating a brand new program that's most likely going to spend and cost more than we're estimating right now, and the things that are being done to quote-unquote pay for it will not materialize. So we'll have a massive deficit, adding more to our debt. This will exacerbate our fiscal situation and not bend the healthcare cost curve. It will bend it upward, not downward, and this will exacerbate the bankruptcy of America.
And what are some of the most outrageous details you've found within the current House bill?
The most outrageous detail in the current House bill is the philosophy on which it is premised. It is premised on the philosophy that the government knows best how to organize 1/6 of our economy, that the government knows best how to make decisions between the patient-doctor relationship. It is this paternalistic, collectivist mindset that has been proven error and flawed time and again that they have an undying faith in. That, to me, is the most egregious flaw in this bill, the overall ideology and philosophy of this. You know, the shame of all this is we could actually fix what's broken in healthcare. We could make healthcare more affordable. We could have a system that gets insurance to everybody who doesn't have it. We could have affordability for people who have pre-existing conditions. And we could do all of this with more market-based, patient-centered, consumer-directed reforms than creating a brand new entitlement program, than exacerbating our debt and our deficits and having spending go out of control. But because of the ideological commitment and fixations of this administration and this Congress, they are going down this path. So there are too many provisions I could point to that are egregious. It's the totality of all of this. Creating the biggest government program that Congress will have ever created since 1965, in my mind, is really what's so fundamentally wrong with this bill.
Congressman, thanks for your time.
You bet.